Hi, welcome to my channel. My name is Sendil. I'm working as a registered nurse in UK, and today's video I'm going to talk about SBAR tool and when do we use, how do you use, and how can you incorporate SBAR tool in our OSCE examination when you are carrying out your evaluation station. So let's talk about when do you use. The SBAR tool is predominantly used when you are handing over about your patient to other healthcare professional. Why do you use? It is a structurized tool which helps you to state your problem to your other healthcare professional, and you have an opportunity to introduce yourself and introduce your patient to others. At the same time, you could able to give a complete picture about your patient background and the recommendation. So let's talk about the each words in detail. So yes denotes is a situation, B means background, A stands for assessment, R means recommendation. So let's move on to the again situation. So under situation, so you need to talk about yourself, which means you introduce yourself and also your current clinical settings, and you need to mention about what changes you noticed on your patient. Then you move on to the background. So under background, it's very important. You have to mention your patient medical history and what sort of medication they are on and what is their social history. So this would give an idea to your other healthcare professional to step in, and then they can take a course of action, and that would eventually benefit your patient. So therefore, so under background, you need to mention what changes you noticed and what is the current health issue of your patient. And then you also mention about your recent assessment. So now let's move on to assessment. So under assessment, you are entirely focusing on patient's vital signs, which includes, as you all know, blood pressure, temperature, pulse, respiratory rate, saturation, and mainly their mental health status or alertness. Sometimes your patient could be alert, sometimes your patient is respond to only voice, sometimes your patient would be disoriented, or sometimes your patient would be unresponsive. So you need to figure out what sort of status they are at that point of your assessment. So once you have all this observation in your hand, you need to clearly state to your healthcare professional. Then you'll have to identify nursing needs and also the medical intervention which you carried out. So once you've done, there should be changes, or else you can seek an help from other healthcare professional to implement a course of action that should eventually benefit your patient outcome. So that's why the final step of SBAR tool is recommendation. The recommendation either has to come from you or other healthcare professional, but as an accountable person, you both would act in the best interest of your patient, irrespective of their health status, and that would eventually benefit your patient outcome. So for your OSCE examination purpose, so if you cover all these tool properly, systematically, and structurized way, you will be able to pass your exam first attempt. But my tip to clear this exam, you need to spend more time in presenting your patient rather than taking more time notes. So the more often the candidate could fail if you spend more time in reading your notes rather than presenting. So the examiner would likely to fail you because you are unable to complete within that time. So ideally, this station would last say 8 minutes, but I would advise you can take a notes for 3 maximum 4 minutes, but please spend remaining 4 minutes to complete about your patient, since you reach this station after doing your assessment, implementation and planning. So therefore you got a complete idea about your patient condition, and you could able to complete this station within 8 minutes without fail. So again, in conclusion, SBAR tool in your practice you would be using in your day-to-day life, and if you're using this SBAR tool for your OSCE examination, make sure you cover completely yourself and your patient, and state their recent observations or assessments clearly, and also recommend a course of action. If you do these things, I'm sure that you would clear first attempt. Thank you so much for watching. Keep following my channel. I'm sure I would able to share some other facts which would benefit your professional life. Thank you.